welcome everybody to Thursdays, what is usually a solo episode, but today it's a little bit different. I have invited my husband onto the podcast. This is the man that cannot make pancakes. We are talking about bedwetting today. I think it's a topic that doesn't get enough airtime. There's not enough conversation about it. I don't think I have ever seen a piece of content, like of all the content on TikTok, Instagram, wherever, Pinterest, like you name it, I have never seen one thing on bedwetting now that I think about it.
I don't think so. No.
And a ton, I don't think it would be on your For You page, but...
I'm a urologist.
True. But a ton of stuff on potty training. And I think that's why people assume maybe that bedwetting is a part of potty training when in fact it's actually different. Anywho, this episode is in partnership with Pull-Ups, also Goodnights nighttime underwear, which is a product that we used for Milo for a long time. So I'm very happy to partner with them and get this episode out there because I think it is needed. So first of all, bedwetting is common. It is more common than we think, again, because nobody talks about it. When I put up the question box on my Instagram stories, I was shocked at how many people submitted questions. I was not expecting that, and I was like, wow, this really is common. So the stats that we have to share with you today are that 9% of children up to the age of 9 have 2 or more episodes of bedwetting per week. Up to 2% of adolescents. I know a lot of the questions that people submitted were things like, my child is this age, like they wet the bed this number of times a week, like should we be concerned? There was lots of that. We will get to all of that in this episode. And then boys generally have a higher prevalence than girls. So before we get into the questions, I just want to again point out that and make this clear that potty training is not bedwetting and bedwetting is not potty training. So what is potty training? And how do you know if your child is fully potty trained? So if your child is consistently dry all day, then they are considered potty trained. When it comes to nighttime, that's a completely different thing, and it can take longer for most kids to stay dry overnight. So that was the case for us. With Milo, he was fully potty trained during the day. That was great. But he was still wetting the bed at night. So we used Goodnights nighttime underwear for a long time. Like, he was potty trained.
Well, I mean, he wasn't really wetting the bed. We just kept the Goodnights on him.
I know, but sometimes he would wake up wet. Okay, so this is what happened. He was potty trained, and then a few times he would experience bedwetting, or he would have an accident overnight. I don't know what to call it because accident seems weird. It seems like it's in their control, but it's not. So, but I'm just going to call it like having an accident overnight for the purposes of this episode. So it would happen, not often, but when it did, it was really upsetting for everybody. Like, obviously, you are, like, woken up very, like drastically in the middle of the night. He's super upset. He's all wet. And then you're stripping the bed of the sheets and getting him dry clothes. It's like a whole thing. And then he feels bad because we just went through potty training and he knows that he's a big boy now and so on and so forth. So we decided to just keep him in the Goodnights nighttime underwear for peace of mind, for his own self-esteem, to not be woken up in the middle of the night. We all had good night's sleeps. Like, it just wasn't a thing. And then eventually he was consistently dry. The Goodnights were dry in the morning for a long time, and then we decided to get rid of them. So that's what we did.
Yeah, and it worked well. I mean, the nights that he did say that he didn't want his underwear or whatever, we gave him that opportunity, and then, sometimes we paid for it at 3:00 in the morning. But after that, he was, consistently fine. So.
Yeah, and another thing that I'll say, and I think I talked about this on my episode with Carrie Bruno, was, or maybe I didn't, I don't know, but Milo, in the last little while, he asked for us to put his potty, so his little plastic potty, in his bedroom. And we were like, that's kind of weird, but we were like, you know what, if that's going to make him feel comfortable, if he wakes up at 4 in the morning and he knows it's still time to go to sleep, he can get up, and he does do this, he'll go use his potty and then get back into bed and fall asleep. So we were like, we have just been super flexible with everything, and whatever makes him more comfortable, that is what we have done. Like, for the longest time, we had the little plastic potty in the living room.
Yeah.
And my mom was like, when are you going to move that to the bathroom? I was like, we will eventually. Like, he's not going to be 13 peeing on a potty in the living room, I promise.
Now he's peeing all over the seat.
Yeah, so now he's peeing all over the toilet seat, but that's a different issue. I went to go pee yesterday, and I had to go have a quick little body shower because I didn't realize he had peed all over the toilet seat, and I obviously sat on the toilet seat and was soaking wet. So there's that. But that's a whole other issue. That's a whole other episode.
We're getting off track here.
Yeah. So first off, let's talk a little bit about risk factors for bedwetting. In your experience, your training, your urology knowledge, what are the risk factors for bedwetting?
Well, I think, the biggest thing, obviously, is age. The younger the kid, the more likely, the more prevalent it is. The other thing is family history. If there's a family history of bedwetting, especially on the mother's side, there's a much higher rate of bedwetting in kids. And obviously things like constipation, excessive fluid intake, you have to rule out things like diabetes and that sort of thing if it's a consistent problem. But those are, few and far between in terms of the risk factors specifically. But certainly things that we have to look for when we're trying to assess patients that have that.
Okay, let's talk about, because one of the biggest questions that people asked was, what causes bedwetting? Like, what is the actual cause? Like, why do some kids do it and some kids do not?
I mean, I think there's various hypotheses in terms of why kids are still wetting the bed, but there's no specific cause. So things like bladder size, their bladders are just not getting large enough to keep up with the amount of urine that they're making overnight, and so they kind of get a contraction of the bladder that causes the urine to go out. Other things like hormone production, specifically antidiuretic hormone. So that's a hormone that's made in the hypothalamus in the brain, and it goes down to the posterior pituitary gland. And so basically what this does is it reduces the production of urine. So if your brain hasn't developed enough to produce enough of this hormone, then you're going to be making more urine overnight. It's the same kind of thing with adults. Like if you drink alcohol, that reduces your ADH production, and you're going to make more urine. And if you've had a couple beers, you're going to wake up, once or twice per night potentially to urinate. The other thing is deep sleep. So a lot of kids are in very, very deep sleep. If your kid is hard to arouse from sleep, if they're the kind of kid that falls asleep on the couch and then people can be walking around watching TV and they're not awoken by that, certainly that can be a risk factor as well, or a potential cause. And other things like environmental stressors, moves, changes in the family, difficult times at school. All of these stressors can impact your sleep cycle and affect things as well in terms of wetting the bed.
I had a seed in the middle of my teeth and you didn't even tell me.
I wasn't looking at your teeth. So.
Anyways, the hormone thing, that's interesting. So is that why when you're pregnant you constantly have to go pee, or is that like a physical space issue?
It's more physical space.
Oh, okay.
Your uterus is pushing on your bladder.
Got it.
Yeah.
Okay. This is a great question because I think many parents out there assume that if you put your child in Goodnights overnight because they are bedwetting, that it's going to like delay the process of them not bedwetting. Can you speak to that just a little bit?
Yeah. I mean, this isn't something you really learn about as a urologist. But, just from experience, ours in particular, I mean, I think that anytime you can contain the leakage so the kids are dry at nighttime, any type of absorbent underwear, it's going to keep them dry, so they're not being awoken. There's no embarrassment in terms of wet sheets, wet mattresses, having to change their clothes and things. I think definitely that's going to improve their own self-esteem, and they're going to be able to adhere to any changes that you make going forward, right? I don't think there's any negative impact to that.
And honestly, just for me, the way I looked at it, I was like, sleep is important.
For everyone.
Like, so one of the things that my husband was talking to me about as we were preparing for this episode was how they have alarms that will go off as soon as they detect wetness on the mattress or whatever it is. And I was like, so that's not, because we were talking about like the concept of like training your child overnight, which is impossible because they are not, like, it's not in their control. It's an involuntary thing. So my husband brought up this alarm thing and I was like, oh my God, I can't think of anything worse than that. Like an alarm going off. So the point of that is to what? Like maybe catch them before they fully release the urine. Like in my mind, that is just a nightmare. And I was like, I would much rather just have them in good nights, comfortable, getting a good night's sleep, and not worrying about it. Like, this is your big boy nighttime underwear for now, and that's it. But anyways.
Yeah. I mean, these alarm systems are definitely one of the tenets in terms of treatment and for kids that are having difficulties with this. But, when to use it is a challenge. It's something that we always offer parents in terms of, this is something you can do if you're finding that this is a problem for your specific family. But, it's definitely something where basically it's awakening them if there's any type of moisture that gets onto the pad. It also protects the bed a little bit as well because it's not going to go through the alarm pad, and then it awakens them so that they know, I leaked a little bit or I had an accident, and sort of, I don't want to use the word training, but certainly can, arouse them enough that they're aware of what's going on, and then eventually, at least the idea behind it, is that eventually the sensation will be enough to wake them up rather than having this alarm go off. To be able to get to the bathroom, or at least wake up and get off the bed, right?
Yeah. And even in that, like, the goal is, I think, to sleep overnight without waking up. Like, as a mom, like, that is my goal. And
that's our goal, but it's not necessarily the goal for the kids, right?
I know, but to consider that for the most part, all children are going to develop and this is going to be a non-issue. like you said, like if it's really an issue for the family, then it's an option. But
Yeah.
geez, like,
And every family's different, right? I mean, you know, there's no one size fits all solution for this.
just like everything in parenting.
Yeah.
Yeah.
So, I mean, it's definitely something where you have to look at your specific situation, and you know, as someone who assesses these kids from time to time, you know, you have to offer the various options, starting you know, from conservative management all the way up to medical therapy, and you know, that's one of the options.
But long story short, using Goodnights nighttime underwear overnight, it's not going to delay any kind of development.
No.
With regard to bedwetting.
There's definitely no evidence to show that.
Okay. So somebody asks, should we nighttime train our 4-year-old? They wake up in wet diaper every morning. Husband wet the bed. I'm reading it as if like how I just wrote it in point form. So her husband wet the bed till he was 12. So do we train or just wait? And I just want to point out before we get started that you cannot train a child overnight. By saying training overnight, you're implying that it's in their control, which it's not. So I just want to point that out.
Yeah, I mean, not at that point, at least. I mean, it's something that has to be. You can't train it, but it's something that has to develop. Right?
And 4 years old, based on the questions that people sent in to me, that's really young.
Yeah.
Because we had a similar kind of question, which we'll probably get to next. Actually, yeah, so I'll just read it. So many questions from people that said, is there a certain age that they should not be bedwetting by? So some listeners wrote in, they have a 6-year-old, 7, 8, 9, 11 that's still bedwet overnight from time to time. So is there an age at which they should not be bedwetting and maybe you should consult a physician?
I mean, like I said, there's no specific age for this. You know, as if we went through some of the statistics earlier. You know, 9% of kids up to 9 years old, and then decreasing after that. You know, 2% of adolescents. So there's no specific age, but you know, I think the biggest thing in terms of being assessed and for this is, you know, the specific family situation, right? I mean, you can have a 12-year-old who is still having accidents, but no one has an issue with that, and so it's not brought up, versus, you know, a 3-year-old that's wetting the bed every night, and, you know, they're clamoring and knocking on your door, trying to get them into your office, right? So, I mean, I don't think specifically that there's a specific age. There's certainly things that we look for when it comes to kind of red flags as to, you know, could this be an issue? You know, specifically if kids were fully nighttime dry for a long period of time and then start to have consistent issues in terms of leakage again at night. If they had daytime continence and they're losing that as well. If they have other issues like, you know, constipation, overactive bladder type symptoms, any kind of neurologic symptoms that come about, any of those kind of red flags would suggest that, you know, maybe this is something new or it's related to something else, and that would be something that should be assessed, you know, by your family doctor, pediatrician, urologist, you know, whoever you see on a usual basis.
And just going back to our experience, it was my thinking, and I wasn't even as knowledgeable about bedwetting as I am now because I've looked so much into this topic. But my thinking was like, okay, we're great during the day. Like, he's got the daytime potty training down pat. Nighttime is going to take longer. And for most children, that is the case. And so to not, like, my advice just as a mom is to not stress about bedwetting because I think your child can also feel that stress. And so I'm really happy with how we did it. Just like, I think it was good for everybody. Like those few nights where he was not in a Goodnights underwear and he did wet the bed, like I was upset about that. Not at him, which is another like major point. Like never punish or reward your child with regard to bedwetting because it's not in their control. I feel so much for kids to think that they, like some parents would actually be upset at their children thinking that it's something that's in their control, and they're just like wanting to have accidents overnight. I don't know, but it's a thing. So yeah, I was happy with just, you know what, the nighttime is going to take a little bit longer. And I would say Milo was in Goodnights for what, like how long after potty training was done?
At least a year.
At least a year. So Milo was perfect at his daytime potty training. Not perfect, like accidents here and there, but for the most part, he was fully potty trained, and he would wear the Goodnights nighttime underwear, and we called them like his big boy nighttime underwear. And yeah, for a year after he was potty trained.
I mean, and then eventually he told us, you know, I don't want to wear this tonight.
Yeah.
You know, and then eventually we just stopped using them, and you know, it's been fine since then. There's the occasional time, like there's probably once or twice in the past year where he's woken up and he's had an accident.
Mm-hmm.
But you know, it's rare for us, thankfully, that he hasn't had any issues.
So somebody else asks, how do you know when they're ready to sleep without the Goodnights? And that is at least 2 weeks of consistent dryness.
Yeah.
And yes, I wanted to ask you about well, you kind of already touched on it, the regression thing. Like,
yeah.
Is bedwetting, because I know for potty training, and I talk about it a lot, how like it's not a linear progression. It's not like, oh, every day after the next is going to be better. Mm-hmm. Is bedwetting a similar thing? Like it can go up and down. Like, oh, they've been dry for a week, and now they had 3 accidents this week. And
yeah, I mean, like I said, definitely there are outside stressors that can be involved as well. So certainly, you know, if your kid has been dry for 2 weeks and then has an accident, it doesn't mean that you're necessarily taking a step back, but there's, you know, things change on a day-to-day basis. As said before, the biggest issue, you know, looking at it from a clinical perspective, is that if they were dry for 6 months and then they started to have consistent accidents at nighttime, you know, every night, every second night for a while, then certainly that would be something to look into. It doesn't mean anything sinister necessarily, but definitely looking at other causes for why that might be going on would be something that I would recommend. And you know, when I speak to family doctors and things, I tell them that as well.
Okay, somebody asks, should we be getting our 5-year-old out of Goodnights? They are still wet in the morning half the time. What is the best age to remove Goodnights? So I feel like a lot of this is similar messaging with regard to like, there is no exact age, and it's more like based on an individual circumstance.
Exactly, yeah, it's very individual.
Yeah. And one thing that I do want to point out is when you're rushing your child to get out of Goodnights, that can, like, I feel like...
It's just like anything. If you're rushing your kid to do anything,
yeah,
it's going
like,
to backfire on you.
It's going to backfire, but it's also, like, creating more stress than I think there needs to be. And also, it impacts... You have to look at it as bedwetting without Goodnights on, like without a protective factor that where they don't like wake up all upset and embarrassed and have to change the bedding. Like when that happens, that is impacting their confidence and it's impacting their self-esteem. Like I think the stat was 2 out of 3 children that experience bedwetting suffer with low self-esteem. So you have to kind of look at it with empathy for them. Not just like ooh, this is a developmental milestone that I want to hit. It's like, no, like, you have to look at it just like with everything else with parenting. Like, be empathetic to what they're going through and how can we make this the best experience for them. So yes, that's my answer for that. I would, if they're still wet in the morning half the time, like, definitely do not remove and just make it a non-issue. Everything's gonna be good. Everything's gonna be good.
Yeah, focusing on it too much is not going to be conducive to actually getting anywhere. So,
and that's kind of what I loved about how we did it. It was just kind of like, okay, we're not there yet. Here's like a tool that we can use where it's zero stress for everybody and it's going to happen on its own eventually. So yeah, it was just like a non-issue. Question, is bedwetting genetic? So you spoke about that a little bit already.
Yeah, so it's certainly, if there's a family history of it, there's definitely going to be a higher risk in your kids. More often associated with maternal bedwetting or on the maternal side. I'm not sure why specifically, but that's just, epidemiologic data suggesting that.
Somebody wrote in about something called retained spinal gland and that it can contribute to bedwetting, but it's something that nobody talks about. So obviously we're going to talk about it. So can you explain what that is? I've never heard of it before.
Yeah, so it's a primitive reflex. You've heard of like rooting reflex and things like that. It's a primitive reflex that as you get older, as the brain develops, you get kind of higher level control over these spinal reflexes, and it's not something that we really assess for. Like, if I see a kid in the office that has this issue, I'm not trying to elicit this reflex to see if it's there. I mean, it's even in my time doing pediatric urology rotations, like, I've never seen this specifically. It may be more specific when it comes to kids that have issues like ADHD and if they're having a neurologic assessment. But basically, if you rub I think it's their lower back or middle of the back, their hips kind of move towards the touch, and sometimes associated with incontinence, like it can cause them to pee, but it's not specific. Like, it's not 100% of the time that they're going to have issues or have leakage. So in terms of being something where you have to check this to see if that's an issue, like I said, it's not something that we look at necessarily in our clinical practice.
Somebody asks, how long before bed should parents limit drink intake?
I mean, I think if it's an issue, like if your kids are consistently having accidents, especially earlier in the night time, then trying to limit it as much as possible, like 2 to 3 hours beforehand would be a good idea. We give the same advice to adults who are waking up at night to urinate. It's a conservative thing you can do, along with trying to get them to pee before bed if they're potty trained during the day. But in terms of being specific about it, it's very specific to the child. If they're, if they can't go to bed without drinking some milk beforehand, would you stop that because they're having these issues? Probably not. But see how that goes for your specific situation.
Another good question. So this will be our last question, and then I'll end just with some takeaway messages. Can bedwetting be related to constipation? This is so interesting.
So especially for kids, I mean, the organs in the pelvis, so the rectum, the bladder, the uterus for females, everything is so tightly packed into the pelvis there that any significant constipation is going to put pressure on the bladder. We see that with kids who have daytime incontinence, who have urinary, overactive bladder type symptoms. Constipation is one of the biggest causes of that, or at least one of the biggest contributors of that, and definitely can have an effect on nighttime incontinence as well.
Would that be an issue for adults?
Oh,
I'm
for sure.
definitely speaking about myself.
Definitely. Yeah, you definitely have that problem. Yeah.
I pooped 3 times today.
Good for you.
Okay. Any last words with regard to bedwetting that we haven't covered that you think?
Yeah. So I think the biggest thing is, as just a recap, basically, it's looking at your specific situation, and if you're feeling like there's an issue, then see your family doctor, see your pediatrician, get a referral to your urologist. If you're not in Canada, just call the urologist's office and make an appointment. It's very normal, and the age can vary in terms of nighttime continence. Don't get discouraged when it comes to this. I know as hard as it is to say that and not experience it. And the biggest thing I think is not to stigmatize kids if they're having accidents. I think that's just going to make things worse and prolong the problem. There are definitely things that we can do that, if your kid is 12 years old and having these issues, they're going to a sleepover or something like that, there are certain medications that we can use that can help with that. It's not something that we recommend using on a nightly basis. It's something called DDAVP. But there are situations where, if your kid's struggling with these problems, but they want to live a normal life when it comes to, socializing with their friends and not missing out on these opportunities, there's definitely other things that we can do to help with that. But at the end of the day, everyone grows out of it.
Yeah.
It's very uncommon to see an adult that has never had nighttime continence.
Yeah.
And so, eventually it's going to get better. You just need some kids just need more time.
Yeah. So. Okay, so I wrote out some key messages or some takeaways that I just want to wrap up with. So, number 1, it is nobody's fault, and you cannot train a child out of bedwetting. Let's just be supportive and approach it with empathy. Bedwetting should never stop kids from just being kids. Goodnights nighttime underwear helps keep them dry all night and keeps their confidence up. When to see a doctor, I think it's really just based on an individual circumstance. I don't think there's any blanket statement like, oh, see a doctor at this time. Like,
aside from the point that I made about, if they've had continence and they're losing it, if they've had it for a long time and there's changes, or, if they start to have daytime issues where they were continent for a long period of time and they start to have accidents, that would be a reason to see your family doctor or pediatrician or whoever to be assessed in that scenario.
Yeah. And 2 last things. It is much more common than you think. I really think people don't talk about it, and there's like a stigma attached to it, and people think it reflects poorly on their parenting, and like that is just nonsense. And also never punish or reward for bedwetting or staying dry overnight because it's not in their control. So thank you guys for listening. I will have another episode next month, I believe, with Carrie Bruno. We're going to talk more about bedwetting, how she helps families deal with it. We're going to talk about self-esteem in kids. So that will be a good one. I really enjoyed my last chat with her. So yeah, stay tuned for that. And if you haven't entered the giveaway I have on the Mom Room Podcast Instagram account, go and enter that right now. You could win a month supply of Goodnights or pull-ups, whatever your family needs, and a $100 Amazon gift card. So, yeah, thanks so much for coming on my podcast.
I'll send you my bill.
Yeah, I bet. How's it feel to have your wife ask you to not make pancakes?
I was going to start off this episode by saying, just to my fans out there on social media, I'm okay.
Yeah.
I'm okay.
He's okay for now.
Yeah.
For now. Yes. I just posted one about the cutting the grass thing, and people are not happy. But anywho, all right. Well, thanks.